Actually, it is not mandatory that the hormonal therapy should be provided only by endocrinologist. Because I think some doctors may feel like we may not have expertise, we have to refer them only to endocrinologist, we may not able to handle. But because all the MBBS doctors, they can be trained, they're already trained on how to provide, say, oral contraceptive pills, or they can easily learn, or it can be easily learned through a short-term, even one-day training program. The same logic is applicable here as well, unless there are, if there are no other complications in the transgender person, and if the person is is diagnosed to have gender incongruence, a trained primary care provider can able to even initiate the hormonal therapy among transgender people following the standard guidelines which are available. The available guidelines like WPATH and Endocrine Society guidelines are quite comprehensive, and it can very well guide the primary care providers on how to initiate and maintain transgender people on hormonal therapy. So even I think me along with other doctors, we have offered training programs for hormonal therapy for 2 days. So and then that training alone may be sufficient for people to initiate hormonal therapy among transgender people. Or some people who are initially not comfortable, maybe they can ask endocrinologist opinion, and then uh, can start the hormonal therapy under the guidance initially, and then at least the follow-up can be done by the primary care providers. And see, previously there was a condition that there should be a certificate from the psychiatrist to at least one or two psychiatrists to initiate the hormonal therapy. But now, even in many Western countries, uh, they are following what is called a informed consent model. For example, if as part of a multidisciplinary team which is offering services for transgender people, if one of the experienced member diagnose the person is having gender incongruence, that person need not be a psychiatrist, because as you know now, the gender incongruence is coming under the sexual health chapter. It is not coming under the psychiatric disorder chapter. So it is no longer mandatory that there is a need, this condition need to be diagnosed only by a psychiatrist or a clinical psychologist. A person who has experience and who is part of the gender transition team, uh, they can actually diagnose whether the person is having gender incongruence or not, document age, and then they can initiate the hormonal therapy after providing appropriate information to the person. So that is called as an informed consent model process, which is actually in practice in many Western countries, including US, especially after the 2011 WPATH guidelines, because WPATH guidelines still talks about getting a approval or certificate from a psychiatrist or a psychologist, mental health professional. But after that, many changes have happened. Even in many leading institutes like Fenway Health Institute, Callan Lord in New York, are providing hormonal therapy on the basis of this informed consent model. So, because that also removes it from the pathologization of the gender identity condition, and it actually, similar to our NALSA judgment, it places the uh, of self, it respects the self affirmation of the gender identity, and we need not depend somebody else to certify that I'm identifying myself as a transgender.